Hello, folks. Good to see you. Season 12. And on today's episodes, we're speaking with Sir George Alleyne, physician, academic, and international public health leader. Hello, folks. Welcome to our 12th season of On the Call podcast with Ozzie, in which we're introducing a new segment that caters to the Caribbean at large. This first episode is brought to you by the Frank and Myrtle Cleghorn Foundation, and we're humbled to speak with Sir George Alleyne O'Garren Allen. As you know, I'm Ozzie, and I'm very grateful that you're here with us on this time-key tour of mine, giving flowers to deserving impactors within the Caribbean basin. Please follow, like, share, drop a comment, and check out our donate and membership pages for our after show called Inside the Call. Every story leaves a mark. Every voice builds a movement. Now, the spirit of On the Call with Ozzie can travel with you, worn, shared, and supported across the world. Visit us for more merch on onthecallpodcast.com/store. Check it out. Thank you. This time with Sir George Alleyne O'Garren Allen. You know, I do as I do. It's going to take a minute, but I'm going to let you know who Sir George is. He was born on October 7th, 1932 in St. Philip, Barbados. Is a physician, academic, and international public health leader. He graduated from the University College of the West Indies, UE, in 1957 as a gold medalist, as professor and chair of medicine, earned an MD from London in 1965, and became professor of medicine in 1972 and chair in 1976. Joining the Pan-American Health Organization, PAHO, in 1981 for research and human resources, assistant director in 1990, and then 1995 to 2003, the director. Named Director Emeritus in 2003. As director, he helped elevate chronic non-communicable diseases, otherwise known as NCDs, human resources for health, and region-wide cooperation, health systems, and Caribbean cooperation in health. After he was UN Secretary General's Special Envoy for HIV and AIDS in the Caribbean, that was between 2003 and 2010, though HIV work represented just a small share of his career. He also served as Chancellor of UE in 2003 to 2017 and visiting professor at Johns Hopkins. Was appointed by WHO, DJ Tedros to the Independent High-Level Commission on NCDs, reinforcing delivery and accountability for NCDs and mental health. His work continues to connect NCD prevention with human capital and economic development. He holds several honorary degrees from several universities, including his alma mater, UE, University of the West Indies. His honors also include Knight Bachelor, and when I say Knight, that's Knight, not the other one, in 1990 from the Queen, for services for medicine, Order of the Caribbean Community in 2001, Inter-American Heart Foundation Science of Peace Award in 2008, and Honorary Doctor of Science, University of Toronto in 2017. A key champion of Caribbean Cooperation in Health, that's the CCH, launched in 1984, and wider health integration through CARICOM. Contributed to the landmark 2007 Port of Spain Declaration. Now remember, he's from Barbados. Port of Spain Declaration, the world's first heads of government summit on NCDs, which paved the way for UN high-level meetings on NCDs. Author and co-author of 150 plus, we think about 200, publications across internal medicine, health systems and NCD policy, fellow of multiple academies and a member of the American Academy of Arts and Science and the National Academy of Medicine in the US. Deep breath. He's married to Sylvan Chen since 1958. 3 children. His memoir, The Grooming of a Chancellor, recounts his Barbadian upbringing, the UE years, and partnership with Sylvan. Now, some anecdotes include being called the Little Doctor Boy, we'll get into that, in Jamaica in early career. This is some of what Sir George Alleyne, I'm just going to say it short, is about. So, we're going to get into some questions now. First question, Sir George, if I may shorten it to Sir
That's
George.
Right. Fine.
When you began your first term as PAHO director in 1995, what entrenched assumption about health in the Americas did you decide to challenge first, and how?
During my term, and I enunciated that quite clearly at my inauguration, the issue of equity in health was what was for me a burning concern. I have been convinced for many years that the inequities, mainly the social inequities, have been responsible for much of the ill health of the Americas. I would contend that you could have differences in material things, you could have differences in wealth, but a fairly fundamental difference, a fundamental level, there should be no inequalities in health. And we define inequity as those inequalities that are beyond the command or purview of the individual. Many people, and we have to establish the discriminator. For example, there are inequities in gender, there are inequities in health, there are inequities in material concerns, etc. But it was the inequities in health that were of greatest concern to me. That was one. And the other one was the idea that the Americas as a whole could do great things if they worked together. So the 2 things that I nailed to my masthead were equity and pan-Americanism, the Pan-American approach. The Pan-American peoples have a long tradition of collaboration, and I felt that if we could put that collaboration into practice in terms of health, we could do great things. The peoples of the Americas could do great things in terms of their health. And in terms of equity, you do not know if there is inequity unless you measure the differences. So a lot of effort was placed into measuring the various aspects of health in the countries of the Americas. And only when you measure those differences, geographically, for example, can you determine where there's geographical inequity and try to have countries put in place the mechanisms for resolving those inequities. So the things that I advocated right from the beginning of my administration, equity in health and pan-Americanism as the 2 guiding principles that would steer my administration.
Looking back, which organizational reform inside PAHO delivered the most lasting value but was hardest to sell internally?
Well, as a manager, you never say that something is hard to sell internally, because if it is hard to sell internally, it usually means you're not a good manager. So I can't think of any internal organization that was not well received or not well actualized during my administration. You will have differences of opinion, and every organogram, is sui generis almost. So there are no differences. I can't think of any differences, structural differences in the organization that provided any difficulty. What I always took the view that the major decisions should be collective ones. And that is why during my administration, I insisted in a cabinet structure, the heads of the various divisions meeting together with me and discussing the important issues of the organization and trying to come to a consensus as to what would be the best way forward. Because if you can do that, then you can get buy-in from the people who actually have to implement the decisions. So I can't think of any obstacles in that sense.
You helped drive Caribbean cooperation in health. What was the smartest trade-off CARICOM ministers made to turn CCH from statement to practice?
Let me give you a bit of background to the Caribbean Cooperation in Health. My predecessor, who was a tremendous public health icon, in my view, Carlisle de Macedo from Brazil, during the wars in Central America, he had took the view that if people could only sit down and talk about some common problem like health, so he established what he called health as a bridge for peace. And he had the same idea that in the Caribbean, although there was no war, there was not the same driving force for stimulus for cooperation, but there was a natural cooperation between the Caribbean countries, which we thought could be strengthened if there were a health focus to it. So that's how the Caribbean Cooperation in Health was born. The idea of Caribbean countries working together to solve certain problems.
Right.
And one of the classical ones was the issue of immunization, for example, because as you appreciate, if one country is not properly immunized, therefore the other countries are at risk.
Right.
And the Caribbean countries were simply magnificent in stepping up and having their immunization programs really brought up to a remarkably high level, so that the Caribbean countries were one of the first to eliminate transmission of measles, for example, of which Caribbean countries were very proud. And in the Caribbean Cooperation in Health, the idea was also to look externally. If one could look at some external donors who would be favorable towards this cooperative approach to health in the Caribbean. And we were able to find some external donors which would fund these cooperative projects in the Caribbean. We are very pleased that the ministers, and one has to give a tremendous amount of credit to CARICOM and the persons in CARICOM responsible for accompanying this PAHO initiative and being the secretariat for this PAHO, joint PAHO initiative jointly with PAHO.
What lesson from the Port of Spain Declaration 2007 still isn't fully absorbed by global finance ministers, in your opinion?
One must never say one is disappointed, but I am disappointed that the world as a whole has not moved with more adroitly in terms of prevention and control of non-communicable diseases. And it's perhaps because of the chronicity of these disorders. There's no rash to hypertension, there's no fever that you get with diabetes initially, etc., etc. It's perhaps with the lack of acuteness that has lulled many countries into saying, this can wait, this can wait. The other one is, and this is beginning to change, the appreciation that these chronic diseases have a major impact on a country's possibilities of economic growth. Now, when first we put forward this thesis, it was poo-pooed like most things that don't sit well with the established order. The idea that these chronic disorders, they destroy both the quality and the quantity of your human capital. And human capital, this goes back to Adam Smith, is those capacities that individuals have, capacities that are generated through their health, their learning, the intrinsic capacity of individuals. And that these NCDs, by the fact that they can kill early, will reduce the quantity of your human capital. And because they are chronic, they can reduce the quality of your human capital. And that is why there's now well established the concept of absenteeism and presentism. In other words, presenteeism, it sounds a silly thing to say, but people, because of chronic disease, can be present at work and not really work 100%, or they can be absent from work. And it's found that these chronic diseases contribute tremendously to loss of productive capacity because of presenteeism and absenteeism. So it's beginning to take root that in fact these NCDs do affect human capital. And there are good data on this, that countries with in most countries, 2/3 of a country's wealth depends on its human capital.
Right.
2/3 of a country's wealth depends on its human capital.
Right.
And this is more so in the Caribbean, where, with the exception of Guyana, we don't have the natural resources anymore. So this aspect of it, this how NCDs affects the human capital is even more germane to the Caribbean situation. So you hope to persuade countries that this is one of the reasons they should be more agile in addressing the problem. But it is not easy. But what is?
Right. There are some things that I would say, but let me move on to the questions because I can sit in that conversation for a minute. Anyway, if you were chairing a cabinet meeting today in a small island state, what 3 cross-sector actions would you insist on to curb NCDs within 5 years?
If I were sitting in a cabinet, first, I would insist on a whole-of-government approach to the problem, in this sense, that it is not only the responsibility of ministers of health, but other ministers have a role to play as well. Ministers of agriculture, ministers of finance. I would want to see the Minister of Finance accepting that we should tax tobacco, alcohol, sugar-sweetened beverages, and these taxes be dedicated to improving the prevention and control of NCDs. That would be the number one approach I would think I would do. Get the acceptance of a whole-of-government approach to addressing NCDs. And within that whole-of-government approach, some specific issues would be Minister of Finance addressing taxation, Minister of Agriculture, for example, addressing the issue of healthy foods, for example, Minister of Education, for example. In the Caribbean, just give it in the Caribbean, one of our major problems is increasing in childhood obesity, steady increase in childhood obesity. So I would have the Minister of Education involved in what kind of school meals are there, what kind of physical activities are children involved in. So it has to be a whole of government approach. That would probably occupy the whole of our term of office. But those are the kinds of things, if I were sitting in the cabinet, that I would do.
You served as UE Chancellor for about 14 years. What institutional move best prepared Caribbean graduates for 21st century health diplomacy?
I don't know that I would wish Caribbean graduates specifically prepared in health diplomacy. I don't know that that would be a major thrust of mine. I would wish Caribbean graduates to have an overall concept of the relevance and importance of health. And of course, I would wish those who going into international relationships to be seized of the canons of diplomacy. But health diplomacy as such, I don't think I would. To go back further, the chancellor, someone said to me when I became chancellor, the art of being a good chancellor is how to, how as he put it, how to influence without interfering. So a chancellor doesn't have the capacity to order what is taught and what is not taught. But if you had to express a wish, the wish would be for your graduates to be all conscious of those aspects of health I just mentioned. And certainly, I don't think I would want, because I don't think I would want any special focus on health diplomacy as such. I'm not sure I would.
You've been also Director Emeritus for 2 decades. Oh, it's a long term. What capability would you add to PAHO today that didn't exist in 2003?
Oh, I would never answer a question like that, because that's arrogance. That would mean that you think there's some deficiency in the organization at the moment, and no ex-director ever does anything like that.
Told you sometimes I put these little
questions. I wouldn't say I would add any capacity that was not there. What I do know, the capacity that has been added, which was not there when I was director, was the capacity in artificial intelligence and the use of artificial intelligence and the use of more modern communication technologies. I think those things have been added to PAHO because of the wisdom of subsequent directors. It would have nothing to do with George Alleyne. So those things would have naturally been added to PAHO, and I have no doubt those things have made PAHO more efficient.
Right.
We didn't, when I left PAHO, the internet was in a sense almost in its infancy compared to what it is now.
Right.
Artificial intelligence was dreamt of,
Right.
Yeah. So these things are now in common use in the organization to the great benefit, I think, of the organization.
Which public health leader most influenced your management style, and what did you borrow from them?
Public health leader. Well, the public health leader, I would have said there are 2 who were influential. One was my former director of PAHO, Carlisle Macedo, and the other one was Philip Boyd, who was an icon of public health in the Caribbean. I could deal with them. Carlisle was a political genius. He had a nose for political correctness, which I admire even to this day. Also, he was sensitive to the political aspects of health and the extent to which health was a political issue. He was a genius in this regard. He was a very, very, very competent public health practitioner. And also, he had the capacity, by his speech to evoke the kinds of images of what might be that were truly impressive. So that was one of the persons who influenced me. And the other was Philip Boyd. Philip Boyd was Mr. Health in the Caribbean. He was in charge of the health desk in the Caribbean. And he had a vision. Perhaps he had a vision, that vision of Caribbean cooperation long before it became a reality. Philip had the vision of there being a Caribbean center for similar to the United States CDC, which subsequently came about as CARPHA, Caribbean Public Health Agency. That was initially Philip had this idea. Philip had this idea of the Caribbean countries working together, for example, to reduce childhood illnesses, childhood diarrhea. He had the idea of making chief medical officers and ministers of health really responsible in their own territories. He was a remarkable figure, was Philip Boyd. Sometimes a bit recalcitrant, but I admired him tremendously, Philip Boyd.
I could hear it in your voice. And
from Dominica. He was from Dominica. Very, I can tell many stories about him. Big. He told me one lesson when he was ill, and in his last days, he said to me, you know, in my business, we never have the luxury of being frustrated. Never forget that. You never have the luxury of being frustrated. That has stuck with me since then. Never have the luxury of being frustrated. Because sometimes things can be difficult. Sometimes difficult things can seem insuperable. You never have the luxury of being frustrated.
I remember that. Your Science of Peace Award in 2008 links health to peace. What concrete example best illustrates health diplomacy reducing conflict or tension?
Well, I mentioned one before, and this was, again, one credited to my predecessor, Carlisle Macedo, when there was conflict in Central America, intense conflict in Central America. And he had the idea that peace could be a bridge for peace. And I never forget going to a Central American country. And the day before, the guns are firing. And there's one day in which there was a universal immunization day. And the guerrillas in their jeeps saying, bring out your children. And the army in their jeeps saying, bring out your children. And not a shot was fired on that day as children were immunized. There was a national, throughout those countries, a national immunization day. And the idea that countries could come together over something so fundamentally common in this pristine sense of something really common, was in great measure a motive for there being peace in that troubled part of the world. If not peace, reduction of conflict in that part of the world. That is the best example I know. And people have quoted it and used the imagery on several occasions, peace as a bridge for peace, health as a bridge for peace, with the idea that at a very fundamental level, all people wish all peoples to be healthy, and conflict runs counter to the idea of all people being healthy. So if we could use health and understanding around health programs, there'd be much better possibility of peace. It is still a very, that day still lives in my memory.
Yes. Because I just put myself there where you have the right and the left, and then everything stops for this to happen. That's impactful.
The warring factions no longer were warring.
Right. How long did it, I would like to know how long after that happened it took for them to pick up their guns again.
A couple of days later, they were back at fire one another. But the idea stuck
Yes.
that it could be done.
Yes. How would you redesign the WHO regional office?
How would I? I mean, offices in general.
Yeah.
Oh, I don't know. That is
To accelerate NCD implementation without adding bureaucracy.
that is beyond my pay grade.
Of all your honors, which one changed what you could do, not just how people saw you?
The honors came, but I can't say they affected fundamentally what I tried to do. Mm-hmm. They came as I did what I tried to do. Mm-hmm. And people, it'd be fatuous for me not to accept that they came because of what I had done. Mm-hmm. But they were not a major jumping off point for me or something, anything like that. None of them. Oh, it is nice. I mean, don't get me wrong. It is nice to be recognized. It is human nature. We are all humans like some form of recognition, but that recognition should not be the driving force in how you spend your days. It should not be.
People need to hear that. You hear that, people? You hear that, people? This is from Sir George Alleyne. Mm-hmm. This is the end of part 1. Thank you very, very much for sitting in on this. I hope you listened to what he just ended with. Thank you to the Frank and Myrtle Cleghorn Foundation for your support on this mission and vision. Audience, click like the button, subscribe, click the bell. When you click the bell, you let us know you support our work and it helps spread the word. Every story leaves a mark. Every voice builds a movement. Now, the spirit of On the Call with Ozzie can travel with you, worn, shared, and supported across the world. Visit us for more merch. onthecallpodcast.com/store. Check it out. Thank you. We're getting ready for the next part. When you're on your beat, stay on the sunny side of the street safely. Be health conscious, kind to one another. And don't forget to give thanks for the little and big gifts as we strive through and to this beautiful life. Again, thanks to Cheese, the OTC team. Thank you, dear Sir George. And thank you for sitting in for this next half.
Yes, go right ahead.
Wonderful. See you. Check in.